Hi, my name is Georgie Kovacs, and I run Fempower Health. I just finished listening to the hearing at the FDA related to SSRIs and pregnancy. It was a 2-hour hearing that was actually quite fascinating to watch, and I'm here now to summarize what some of the key takeaways are and what we need to do moving forward. Before I dive in, though, I do want to give some perspective. I am not here to say SSRIs are good or bad or anything else. I just want to summarize what I learned, but also to share the perspective that I bring to the table, which is I have worked in the healthcare industry as a consultant for well over 25 years. And for the past 6 years, I have interviewed leading clinicians around the world in all aspects of women's health. And I've also collaborated with a lot of advocacy groups. So I have a really broad perspective in people's experiences of the healthcare system and the business of healthcare, which sadly it is a business. So that's kind of the perspective I'll add into this discussion. I am not at all here to judge the medicine of it, but I will summarize what some of the themes are. So what made the panel interesting is who they brought to the table. So you had OBGYNs, psychiatrists, developmental scientists, and people who help women taper off medications. Some of them supported SSRIs in pregnancy, while others feel they're overused or even harmful. But the diversity of views made for a rich discussion. And why is that? So let's talk about mental health. What is it really? A big theme that was being brought up was the term depression too broad. Now, let me pause there because after they did the 2-hour dialogue, a lot of the medical societies had written statements in reaction to the FDA hearing. And one of the statements was, this was a discussion on SSRIs and depression, not a discussion on mental health. And perhaps this forum wasn't the place to have the broader discussion, but it did happen, and I do think it's worth addressing, but I don't disagree with those statements made. So because they did discuss the broader pieces, I'm going to summarize them for you because I do think they're really important. So my takeaway was really starting with mental health and how we deal with it. Because, especially as a pregnant person, you're dealing with so many factors of stress, right? Your body's changing, the anxiety of becoming a parent, and all of these other factors. The question that the experts had was, and even if you're already on an SSRI, right, before you become pregnant, what does that mean? Which stage of your pregnancy should you be on an SSRI, given what the data shows? And there's a lot of discussion around meeting women where they're at and really understanding that broader piece. So from a depression term specifically, some shared that they may feel that that's too broad of a definition. Some panelists said that the normal human struggle is being labeled as clinical depression, and as a result, people are quickly reaching for medications without understanding the full context. And others pushed back, saying that dismissing depression can put lives at risk. So it really came down to, are we giving women the right diagnosis or just a fast one? And I think this is really important to consider because, the journey of navigating mental health is really important to understand. And so you can see why some were frustrated with how this dialogue went, because then I will say, I didn't come away necessarily saying it was really, really clear which way we should lean around SSRIs and pregnancy. But I do think it's fair to at least just ask the question of, how are we defining depression? So some of the concerns were that there was so much advertisement when the SSRIs first came to market that the lingo has changed in how we talk about mental health. And depression is almost this overarching term that we just use very easily and throw it around instead of being really clear on it being a clinical diagnosis. So that I think was where the concern was. How are we even diagnosing it? It's a checklist. Is it a valid checklist? And again, I am not here to judge and say right or wrong, but I'm just saying these interesting points that people brought up around let's just first talk about what is depression and make sure that we're on the same page there. And I thought that was actually a very fair and interesting point. The next layer was, okay, so then is there an over-medication debate? And this is where the tension about whether SSRIs themselves are too readily prescribed. Some were saying that women deserve full informed consent and access to non-drug options. And others argued that because care is so fragmented and therapy is hard to access, SSRIs might be the only realistic support women get. And the truth is, the system is broken and it puts everyone in an impossible position, irrespective of whether or not an SSRI is a good or bad thing. So just to overlay on that point, like they were talking about the journey of you may go to the pharmacy and go pick up your SSRI, and while all the warnings for SSRIs are there and they say, hey, do you want to sign this? Does everyone read it? And some may say, well, you should read it. It's your responsibility. But I think what they were trying to say is, okay, if there are warnings, then let's make it easy for the consumer to understand them, because those package inserts, they're filled with a lot of medical terminology. They're not easily laid out. It can be overwhelming. The other interesting point, and again, I'm not an expert in SSRIs, but one of the points that they shared is that even across the classes of SSRIs, the warnings vary depending on which branded drug you're taking. And again, I'm not an expert in SSRIs, so I can't comment specifically on why they may have nuanced labels. I know the process is the pharmaceutical company will draft the label and then the FDA will make comments to it. So that's kind of how it works. But obviously the FDA does look at those labels. Some felt that the FDA maybe didn't do as good of a job, and they felt the pharmaceutical companies are running the show in that respect. Having worked in the industry, I don't think it's that easy. What I thought was cool, though, is a week or two ago, FDA actually did a menopause hearing, and it was the opposite. It was the labels are too strong, and depending on the type of estrogen you're using, the labels should be different. And so it was just funny how the conversations were night and day across those two topics. And now we get to why the panel was actually there. So again, we had the whole like SSRI debate, we had the mental health debate and how we navigate the system. And now we talk about SSRIs in pregnancy specifically, which was the ultimate reason why this panel was together. So there wasn't as much time to dive into this data. And by the way, post the panel, some of the medical societies were saying that a lot of the data was actually outdated and they were concerned by how it was represented. And I'll put the links again below so that you can read those actual statements because they're really, really interesting. I just want to be efficient for your time here. And they were really concerned about how the data was represented. I know one of the panelists during the panel actually said, technically you could, if there's any way you want to spin the story, you could find the data to support it. And so that was really interesting dialogue as well. Okay, so again, back to SSRIs and pregnancies. So the experts kind of did agree that the data is messy, and some warned of potential risks of fetal development. Others emphasized that untreated depression also has real consequences like preterm birth, poor bonding, and suicide. And so there's no one-size-fits-all answer. But everyone did at least agree that we need better research, more nuanced guidance, and a lot more compassion. But really the bigger problem is that the panel wasn't really, again, just SSRIs. It was about how we treat women, right? And it's not women alone. It's everyone. But again, because the panel was SSRIs and pregnancy, we're going to focus on the female population. So appointments are short. The labels on medications, as I had just mentioned, depending on the SSRI, they're inconsistent, and there's no time for full conversations. And the OBGYN often becomes the default primary care provider, even though that's not their role. I wanted to talk about this a little bit further. What's interesting is I'm actually doing research right now on who owns women's health, and it's really fascinating because the way primary care doctors are trained versus the way what OBGYNs are trained on, there's a lot that overlaps, but not all of it is. So imagine if you're just relying on an OBGYN and the OBGYN thinks you're going to a primary care and no one's triple checking that. Unfortunately, you're kind of the person navigating your health who should be triple checking that. And so I personally go to a primary care doctor and an OBGYN. So that's that part. But because of how things are structured, unless at a physical, those are longer appointment times. So it really depends on the type of appointment that you're booking, which influences how much time you have with your clinician. Now, obviously, if you're going to a cash pay doctor, you probably get a lot more time with them. And so imagine you're a woman who is really struggling and you're like, I'm struggling, I need this help. And then the physician's also in a rush. And by the way, I'm not pointing fingers or blaming anyone. I'm just painting a picture for some of the things that were indicated in this discussion and what I've heard people sometimes experience, right? So imagine it's just quick conversations. You maybe even insist on an SSRI as a patient, or perhaps it's just a rushed conversation. The doctor prescribes it, right? So then my question would be, who really should be prescribing these? Is it, enough for the OBGYN to do it or not? Then the question is, okay, well, if it is a psychiatrist, I can tell you, knowing that I see a psychiatrist, it is not easy to find one. I still remember years ago when I was living in Connecticut in tears because I called, there were 30 psychiatrists, and either they weren't taking, actually, I think all of them weren't taking new patients. And the only way I was able to get an appointment is to find someone where I had to pay out of network. And since then, I kind of learned that that's just the deal. And sometimes you can find centers where residents are in training and you can go see those psychiatrists. And so, then and then there's the psychologists, and if your psychiatrist just prescribes meds or sees you. So even if you are trying to do right and navigating the system in that way, it's really, really difficult. So, and this is for the privileged folks like me that can afford to do these things. This is not the access that everyone has. And so I do think it is really important to have that SSRI and pregnancy discussion, but then I do think it's important to think about the journey of the patient and the capacity of the doctor and healthcare system to navigate all of this. So going back to the SSRIs, again, the OBGYNs that were there, I think these are very valid points. It's always about informed consent, and it is always about a two-way dialogue about what is best for you. And when we go on any medications, it shouldn't be a quick conversation. And I know we have short appointments, but we as patients can also advocate for ourselves and ask the clinicians, tell me about these medications. What are the risks? What are the benefits? Could I have side effects? Could this impact A, B, C, or D? Because remember, when you're taking these SSRIs, so let's say you become pregnant and you didn't realize you're pregnant and you're on the SSRI, you can't just stop taking it and then be fine, because you have to taper off. So one of the suggestions, which I thought was absolutely beautiful, is let's assume you are in a place where you're planning your pregnancy. You should go to your primary care doctor and have a discussion and say, look, you're at your annual. Just say that I'm trying to get pregnant. Let's make plans, because there's actually a lot of things even outside of SSRIs that you should have conversations about. And it's complex, right? Because if you are dealing with mental health issues, and I do think this is a fair statement, I've even interviewed experts on this, is maybe there's lifestyle things that you need to do. Maybe there's loneliness. Parent had just passed away, maybe you've lost your job, and the question is, do all of these things require medication or not? So again, it was an interesting dialogue because they kind of mixed it all up, so I could see why some of the societies were frustrated, because there's a little bit about, are we talking SSRIs or are we talking mental health? And again, broadly, we need to cover all of these topics, but from an SSRI pregnancy perspective, I would say that there was agreement that we do need more randomized controlled trials in pregnant women. We could give pregnant women informed consent on the risks and benefits of partaking in a given trial so that they can make a choice, just like when they talk to their clinician and they talk about the women's health, mental health, and pregnancy, and figure out what they need to do based on the risk benefits of that individual. And there were a lot of people who were kind of indicating that as well, as it's a dialogue. My concern, again, is this is all great and ideal, but the way the healthcare system is structured, it's not so easy to do that. So what's really next? At this point, if you're listening and you are trying to get pregnant, know of someone who is, or you're navigating the healthcare system, I think the first thing is, again, like I said, go to your primary care doctor, tell them you want to get pregnant and what should I be thinking about, and have that dialogue. And make sure you talk about all the medications and also add in the things that are happening with your life so that they can help you from a holistic place. And I think that's one of the problems with our healthcare system is and even the way we think about things, everything is fragmented and siloed. You go to this doctor for this thing and this doctor for that thing, and maybe there's this overarching thing that's going on with you that can help you. And so just make sure outside of this whole debate of SSRIs and pregnancy, it's really important to share as much as you can with your clinicians so that they can help best serve you. And so, another thing that they had said is let's meet women with where they're at. And so again, why it's important for self-advocacy. So I hope this resonated with you. I'm going to again put a link to the FDA hearing itself if you'd like to dive more into it, because it was a fascinating thing. It's thought-provoking, but I do understand what some of the societies were saying, which is, yeah, some of this data that they presented was just a little outdated and not really representing the correct information. So I do think it's important to take that into account, but it was still an interesting discussion. So at the end of the day, I think we'll see what's going to be happening to labels. Some had said make the labels more clear, more consistent, but I think at the end of the day, generally people agree it's a two-way dialogue where the patients need to know what's going on to make their choice. So if you like this, I'd appreciate your support. Subscribe to Fempower Health. I also have a weekly newsletter where I talk about all things women's health and would really appreciate your support. And if you have feedback or comments to this, please put them below and feel free to share this with anyone who would find this relevant. And I hope this was helpful. Again, I love the conversation because I'm so passionate about the system of healthcare. And I'm really glad that they had this hearing, and we'll see what's next. Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find the link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.